We live in a very divisive time.
Yeah.
And things are going crazy. And I remember 2 years ago when we were right in the thick of COVID, and I know COVID's still a thing, and I know that, but right when it was coming out and nobody knew what to do. And a lot of people were staying at home. There was a lot of isolation. And I remember you sitting in that exact chair right there going, the next epidemic is going to be
mental health.
Mental health. And
Yeah.
here we are in May, it's mental health awareness. And I don't think we've done enough, just to be honest with you. I mean, I think we're trying, and everybody's doing what they can, but it's one of those things that people don't understand. Mental health is such a large umbrella, and most people don't know what falls underneath that, or how to handle it, or how to deal with it, where to find help, what kind of resources are available.
Even when to say I need some help, life in general is stressful and challenging, and most of us like to be tough, say, I'll use my skills, I'll press through, and that's all good and healthy. But at some point, sometimes you have to realize I could reach out and use a little bit of help and guidance. And that's usually when I would say, if you've had more than a string of 3 or 4 days in a row where you haven't felt like yourself, if you're starting to have thoughts that are like kind of hopeless and pessimistic, here's a fancy word, anhedonia. If you start to feel like things that used to be enjoyable are no longer enjoyable, like Casey, for you, if you went out to golf one day and it was a great golf day, but you left feeling like I didn't really enjoy myself, those sorts of red flags are an indication that you maybe are getting worn down. A lot of people are worn down. I've had 2 conversations already today with people that employ other people about the difficulty getting people to work. And so there's just this strange social experiment, I guess, going on right now. And I do think that our mental health is taking a little bit of a hit. In fact, one article I read just last night before I went to bed was talking about research over the last 10 years and correlating the rise of social media and digital devices like the iPhone in the hands of teenagers and their poor sleep and their decline in mental health. Isn't that interesting? Here we are right now with more access, right in the palm of your hand than ever before to talk to a crisis counselor, to get input and help on anything you need. Yet our teenagers are having some of the worst mental health issues across the board than they've ever had before. And one of the reasons is likely poor sleep due to being on their devices really late at night. And so when we look at research, sometimes we can intervene in a positive way. So I would say one mental health thing you could do for your kids this month, anybody out there who has kids, and by the way, this applies to adults too, is learn to turn off devices maybe an hour before bed. I know that's going to cause major conflicts with teenagers all over. But if you can help them understand that what you put into your body affects what you can get out of your body. And so we see that with food. That's easy. It's easy to talk about that with drugs and alcohol and things like that. It's even easy to see that with exercise. But what about sleep? We sacrifice sleep like crazy. And who needs sleep more than somebody whose body is growing at a rapid rate? So your older children who maybe already have a phone. I mean, I know most elementary school kids have a phone at this point.
I'm guilty. My 10-year-old's got one.
Well, there are real benefits to those young kids having it. I can be in touch with my teenager anytime I need to. But on the flip side,
how much is that phone used for phone calls versus watching stuff on YouTube and TikTok and Instagram?
Yep, exactly. And so I would say an hour before bed, learn to turn those off, plug them in somewhere, engage your brain other ways so that you can get good sleep. If you can do it, your teenagers can do it. Right there's a mental health tip for May.
And for me, I would say, during the month of May being mental health awareness, have a little empathy, have a little compassion, have a little more love in your heart and in your conversations, because those really mean the difference to me. They do.